welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. Today's show keeps you in the know by conveying important and interesting information about the contemporary topics that impact you, our viewing audience. On today's show, we're pleased to present a segment featuring the Baltimore County Public Library. Join Paula Miller, Director of the Baltimore County Public Library, to learn about the many services the library offers its patrons. We guarantee you'll be pleasantly surprised. Also on the show is Debbie Orlove, Community Business Liaison at the Baltimore County Department of Aging, who concludes today's show with information about senior center travel, senior box office, and what's happening at your local senior center. Let's start today's show with an important topic, Medicare. Navigating Medicare can be quite a challenge. To learn more about this topic, let's start the show with Sherry Kolbe, Program Manager of the State Health Insurance Assistance Program, known as SHIP, at the Baltimore County Department of Aging. Welcome to the show, Sherry.
Thank you for having me.
Before we talk about Medicare, let's talk about what is the State Health Insurance Assistance Program known as SHIP.
Okay, actually every county in the nation has a SHIP. Our mission is to educate our own county's constituents about all facets of Medicare. Therefore, our phones are open and we talk to people every day of the week about any question that they would have about Medicare. We try to assist them.
Okay, let's turn to the heart of the matter, Medicare. What is Medicare and who is eligible for it?
Medicare was devised in 1965 to provide an insurance for people who were 65 and over. Gradually, it expanded to include those under 65 who are on disability, individuals as well who have end-stage renal disease.
How and when should people enroll in Medicare?
Well, if you're already getting a Social Security benefit, either through disability or age, then you will automatically come on board to Medicare, the 25th month of disability, or at age 65. However, if you're 65 and you are not getting a benefit, then you do need to take action by calling Social Security, either by phone, visiting them, or online to enroll.
Now, I also understand there's multiple parts to Medicare. Can you talk about the different parts?
Okay, there's Medicare A, and that would cover you if you were literally admitted to the hospital, after 3 midnights transferred to a skilled nursing facility, and maybe therapy after that. Part B is considered medical. It pays for the doctors, whether you're in the hospital or out of the hospital, ER, preventive services, your flu shot, durable medical equipment, blood x-rays, and so forth. Then Part C is, we'll get into, they are the Advantage plans, which are Medicare HMOs and PPOs, and I look at them as substitutes for your original Medicare benefit. Then there is Part D, which is drug coverage.
Okay. We're going to take a short break, and when we return, we're going to learn more about the ABCs of Medicare. Let's continue our conversation about the ABCs of Medicare with Sherry Kolbe, Program Manager of the State Health Insurance Assistance Program at the Department of Aging. Sherry, let's turn our attention to Medicare Part D, which is Medicare's prescription drug benefit. Can you explain the benefit as well as some of the important facts to remember in selecting a plan each year and how to enroll in them?
Yeah, well, Medicare Part D was designed for those who do not have a retiree health benefit. And what it does is it does, through 21 actual private companies, provide the drug benefit. It consists of, in the beginning of the year, a deductible for the majority of the plans, although 7 still do not have a deductible, an initial coverage area where basically you pay no more than 25% of retail for the drugs, the donut hole where now one pays 35% of retail for brand drugs, and then if you literally have gone through about $7,400 in drug cost, you get to catastrophic coverage. The Part D plans are permitted every year to change their formularies, tier structure, deductibles, pharmacy contracts, and so forth. So every single year we highly recommend anybody on Part D to have research done. We offer this at the various senior centers, and you can call the SHIP office to make up an appointment for one-on-one counseling.
So basically you're saying if it was good for 1 year, you still need to check it for the next year.
It's a prudent thing to do it every year. Certainly if you've not done it for several years, it is highly likely we might be able to save you some money.
Always good to hear.
Absolutely.
I understand that some beneficiaries may need supplemental insurance, such as Medigap plans. Can you give some information about this plan to our viewers?
Okay, Medigap plans work with original Medicare, meaning you're using the red, white, and blue card, and you do not have an Advantage plan, an HMO or a PPO. Okay, with the Medigaps, they are designed to fill in what I call the holes of Medicare, some of the copays, deductibles, and so forth. The Medigaps are another alphabet soup of letter A to N. It depends upon how much coverage you want to have, the premium you would like to pay, and so forth as to which one you'll select. The main thing to remember with the Medigaps is the time to buy them is the first 6 months you're on Medicare Part B. Outside of that window, the insurance companies will use medical underwriting to see if they would like to cover you and how much the premium will be. But there is definitely no annual open enrollment for Medigaps.
Now, some of our beneficiaries may be on a low income. Can you talk about some of the assistance programs that are available to them?
Okay, well, as far as getting assistance with the drugs and their prescription plan, essentially if an individual's income is under $36,000 and a couple is under $48,700 a year, there is something out there to help you. Now, there's the Maryland Senior Prescription Drug Assistance Program to help those with the higher income level, but those who, let's say, potentially their income's under $18,000 a year. Now, these figures, of course, are individualized for individuals and couples, but then you might be eligible for partial extra help or full extra help, where you get help with the premiums, the deductibles, and the actual copays. There's also programs, strangely enough, called Quimby and Slimby, which literally help with the Medicare copays and deductibles or premiums. When in doubt, call the office and we will assess and help to enroll you.
Okay, in closing, is there anything else that you would like to share about Medicare?
Okay, the main thing that Baltimore County is experiencing right now is that MedStar has elected not to continue with their Medicare Advantage plans. Therefore, if you are on a MedStar plan now and you've received a letter that it's ending December 31st, first of all, don't get too anxious. You have a lot of options. You can call our MAP office, 410-887-2594, in order to get a packet. And then I will be going out into the community doing presentations, particularly Parkville, Essex, Dundalk area, and so forth. So please call the offices and we will try to help you.
That's wonderful. Thank you for sharing this information with our viewers. We're going to take a short break. When we return, learn about Baltimore County Public Libraries.